Hello, I'm Zara Imtiaz, welcoming you to another Asian Agribiz podcast. Today, Issa Kirtan talks to Dr. Mary Grace Alba, technical consultant at Elanco Philippines, about vaccination, its role in disease control and prevention, and key factors for designing effective vaccination programs.
Hi, Dr. Alba. Thank you very much for joining me in this podcast. Today, I'd like to talk to you about vaccination as one of the strategies to prevent diseases in livestock and poultry production. We know that the industry is fraught with diseases, and prevention and control are even more challenging today. So, moreover, there is the growing call to reduce, if not eliminate, the use of antibiotics as preventives. But before I saddle you with the questions, can you tell us briefly about yourself and your experience in the animal protein industry?
Yes, so I'm currently a technical consultant and a veterinarian by profession in Elanco, Philippines. And I worked in the swine industry as a technical consultant for 10 years. And I've worked in the farm. I started my career in working in a swine farm for 5 years as a breeding supervisor. So I was also employed in Novartis. And from that, I started to handle vaccine products from Novartis before it was transferred to Elanco. So that's my background about vaccines.
Okay. Well, let me begin with the basics and ask you what is the importance of vaccination in animal production and why, despite its crucial role, there's still some pushback against it.
Okay. So vaccination is an important tool for disease prevention and control. And the goals of vaccination basically is to first decrease the number of susceptible animals that would incur the disease. Next is reducing the clinical disease in the farm or in the herd. And then the third one would be control of pathogen spread within the farm. Now, in terms of some pushbacks on vaccination, probably one would be efficacy. No, so some producers would question the efficacy, not just the efficacy, but safety of of a vaccine, because this is very crucial. On safety, we're talking about reversion to virulence. So some vaccines can do that. Can they revert? They can revert to virulence, meaning they can cause the actual disease in the animal despite vaccination. And then there are also factors on post-vaccination reactions resulting to allergic responses, effect on feed intake, fever, or even death. And some farms, especially those that are in the backyard, they would consider price, and some would consider availability or supply, especially in provinces that are far and does not have the proper packaging that they need to be able to accommodate all the animals or the small number of animals in backyard, for example. Vaccination failure is also a factor, and some farmers would say that the disease is not present in their herd, so that's why they don't need to vaccinate it with a certain vaccine. And the last one, I think, would probably be on seasonality. So seasonality is actually a misconception. Some producers believe that some diseases occur in certain seasons, so they would not vaccinate it for the whole year. So those are the factors.
Okay, you mentioned about vaccine efficacy. What is your assessment of the vaccines in the market? Are they generally good or are they really superior vaccines?
Actually, in the market, commercially available vaccines are generally okay. They're good. They serve their purpose for that matter. This is because before a vaccine is approved to be used in animals, it undergoes a long and rigorous process of research and development, licensing, trial phases, as well as regulatory approvals. So, scientists and inventors, they make sure that a vaccine sold in the market should be safe and effective, or else they will not launch it. But however, in terms of superior vaccines, there are some differences in terms of advancement in technology, especially in poultry and swine. For example, recombinant vaccines. Today, I have no knowledge of recombinant vaccines that are used in swine, but they're already in poultry. And I've not heard of superior vaccines, but there is what we call market leaders. So market leaders are vaccines that are actually the one that is usually used by producers or farms in the country.
Okay. What should producers bear in mind when they are developing vaccination programs for disease prevention?
So first, the producers should consult a veterinarian. The veterinarian would diagnose and know the disease status of the herd. So right diagnosis is important, which includes laboratory testing like PCR, slaughter check including lung lesion scoring, necropsy, recording animal performance, and clinical signs that can be used as diagnostic tools. So aside from that, when you have already diagnosed a certain disease, you can now consider the right timing in designing a vaccination program. And one more important thing is that there is no such thing as one vaccination program for all farms. A program depends on the disease status of the animal, of the herd, and the risk of getting that disease. And last but not the least would be immunization and vaccination failures are possible. So there are some factors which includes host, human, and vaccine factors.
Okay, so there's that possibility, like you said, of failure.
Yes.
Normally, what causes those failures?
Okay, so I've mentioned we have host, human, and vaccine factors that may cause vaccination failures. So host factors includes high concentration of maternal antibodies. So the right timing is important in there. That during that time they would overcome this high concentration of maternal antibodies in piglets and, for example, in small animals or in their young, in their piglets, and they're able to mount the expected titer or antibody or protection needed by the animal to fight a field challenge. Next would be immunosuppression, or when the animal is sick and then you vaccinated it. So basically, the vaccine would not take an effect or it will not mount the proper immune response. Third factor would be pregnancy. So we don't recommend some vaccines in pregnant animals. And then the factor of age, so very young and very old animals, a nutritional deficiency, malnutrition for that matter. If an animal is experiencing malnutrition, then again, vaccines would not work to them. And also, as I've said earlier, if the animal is already affected with the pathogen, which is also called subclinical infection. So other factors includes stress, mismanagement of animals, and drug treatments or antibiotics. When it comes to human factors, these factors includes vaccinating animals currently infected with the pathogen, improper mixing or rehydrating of vaccines, especially in live vaccines, administering incorrect dosages, administering vaccine too frequently or not frequently enough, using outdated or expired vaccines or products, using contaminated equipment and vaccine, or administering vaccines that are too cold. Remember, vaccines must be warmed at room temperature before administration. Or wrong way of handling or restraining the animal, which causes stress to the animal. So when the animal is stressed, vaccines may not work on them, or there would be vaccination failure. Vaccine factors, for example, would include wrong strain of pathogen or improper and inadequate adjuvant. There is too little antigen in the vaccine, improper storage, careless handling, and some equipment that was used in vaccination has been cleaned with disinfectant or sanitized with disinfectant. So those are three important factors to consider when you look at vaccination failures.
Okay, my next question, I guess, is basically related, and how can producers ensure that they are doing vaccination programs or the vaccination administration properly? What strategies should they be taking?
So I think the most important thing to do is do a vaccination audit. So vaccination audit includes checking and review protocols on vaccine handling, storage, transport, on-site vaccine preparation, on how you properly administer it to the animal, what is the proper equipment you use during vaccination, how to handle the animals, how to restrain the animals during vaccination so that they would not there would be less stress, post-vaccination reaction and how they observe the animals after vaccination and adverse reactions, as well as recording and inventory of vaccines. And last but not the least would be proper disposal of waste or materials that are used after vaccination. So these are the things that we look at. We train the people in the farm doing vaccination and also inform the owner of what other improvement they can do on how they are going to do their vaccination to their animals.
Okay. Do you find that it is easier now to educate the farm workers and the farm owners on vaccinating properly?
Yeah, I think this is better now since there are a lot of online meetings now. We can do trainings and we can communicate with them even face to face with the people in the farm as well as to farm owners to remind them of the proper ways on how they should do their vaccination.
Okay. My last question. Animal production is moving away from antibiotic use because of fears of AMR. So, can you please explain how vaccination can help producer adjust to this development? Because as they say, things now would you should be focusing on biosecurity and vaccination and making sure that the herd or the flock is as safe as possible from pathogens.
So let us remember that vaccination is a tool that is used to prevent a disease. But when a disease is already present and invading the host or the animal for that matter, causing sickness, especially bacteria, you have to treat it with the appropriate regimen, which is antibiotics. And with that, responsible use of antibiotics should be kept in mind when doing so, which is aligned also in the priorities of AMR, right diagnosis, right drug, right duration of treatment, such as those things. And to effectively use vaccination as a strategy to prevent disease, producers should understand its principles, use, and limitation. So the most important thing is actually consulting a veterinarian to make sure that you are properly using vaccine and how would you do your vaccination properly.
Okay, so vaccine on the whole is preventive. It is not a treatment.
Yes, correct.
Okay.
So if an animal is already infected, there's no assurance that a vaccine could actually treat them.
Okay. So it's a matter really of getting your flock or your herd ready or prepared for any potential entry of pathogen. You prevent the pathogens from going in, or if they do get a pathogen, it will not be as
Uh,
serious
yeah.
as without the vaccine. And it would also help in preventing or minimizing spread of the disease.
Yeah.
Is that correct?
Mm-hmm. So you can control the spread of disease, but using vaccination, you can do that. But if the animal is already sick, then there's no purpose of treating the animal with the vaccine. But you can protect the next herd or next batch with vaccination. In summary, vaccination is an important tool we use to keep our animals healthy. It is important that before doing it, a producer should be guided on how to use it properly. There are a lot of factors that can contribute to vaccination failure. Vaccination does not always equal to immunization. When we mean immunization, it is actually the protection that the animal received after vaccination. And high titer of antibodies that is produced by vaccine does not always guarantee protection against diseases. So we always look at the physical state of the animals or herd in general and other parameters such as growth performance to see if a vaccine or if our vaccination is working properly.
Okay. So it's not a one to one thing. That's the I think that's where some of the problem lies, is that some people think the vaccine is a silver bullet that will answer
Yes.
everything, and they must remember that it's not. That you
Yes.
have to do other things as well.
Yeah, that's what we call unrealistic expectations about vaccines.
Okay, well, once again, Dr. Alba, thank you so much for talking with me tonight.
Thank
I
you,
really
Miss
appreciate it.
Isa.
Vaccination is a vital part of a comprehensive disease prevention and control strategy, demanding careful planning in animal production. We hope you found this podcast insightful. For more on Asia's animal protein industry, visit www.asia-agribiz.com. Join us in our future podcasts.